towards that connectivity. But a lot of cargo historically used to move in the belly hold of those passenger aircrafts across borders into Africa. So with the loss of passenger flights, now that cargo becomes even more valuable, and freight operations need to take place to ensure that not only personal protective equipment, but now vaccines can reach the most remote parts of Africa. Late last year, IATA put out a statistic that if we needed to administer a single dose to about 7.8 billion people around the world, that single dose would require nearly 7,000 or 8,000 Boeing 747. So that gives you a scale or appreciation of the logistical challenge. So from an industry perspective, that capacity and restoring connectivity to the African continent is important. Also, governments that have stringent health measures such as quarantine and stringent testing are a deterrent to restoring that connectivity, whether it's for passenger operations or cargo operations. But also, as alluded to this panel earlier by my fellow panelists, the capabilities, the infrastructure, the peoples and processes, but also ensuring that we have adequate border facilitation measures. As pharmaceuticals are time-sensitive goods, we need to ensure that not only do we have the temperature control regulations and requirements, but also customs and border control agencies are able to facilitate those vaccines in the fastest manner possible.
And just on the capacity issue, it sounds like from speaking with the other panelists that the vaccines are getting through partly because supply isn't as high as it probably should be. So can I take it from that there so far hasn't been any strain on the air cargo part of the supply chain in Africa?
Well, from an industry perspective, as mentioned, due to the erosion of scheduled passenger operations, we've seen a nearly 2/3 loss of capacity for cargo as well. And now, essentially, any goods coming to or going from Africa need to be on either dedicated freighters or airlines need to look at innovative ways of serving the African continent. One of the things that the industry did was very quickly respond to converting passenger aircrafts for cargo operations. So the likes of Kenya Airways, Ethiopian Airlines on the African continent were very quick to retrofit or modify aircraft so as to be able to carry face masks, personal protective equipment, and now vaccines using aircrafts that were originally designed for passenger movements. The challenge for Africa historically has been connectivity, not only to international markets, but also within the African continent as well. And as and when vaccines become available and the COVAX facility or other procurement methods become more popular, that connectivity to not only the major hubs such as Addis as well as Nairobi, but also to the tertiary and remote parts of Africa becomes even more important.
And how does the, on capacity aside, how does the integrity of the vaccine air cargo supply chain be maintained? I mean, clearly, it's technically very complex. You need to move the vaccines around, and they need to be stored at very sometimes extremely low temperatures. I know that IATA has looked at standards for pharmaceutical transports and cold chain. Are those standards now bearing fruit in places like Africa when you have a situation like you have to distribute a large amount of vaccines in a relatively short period of time?
Absolutely. So transporting vaccines is also much more complex than other goods. It requires a network of, as you rightly mentioned, temperature-controlled facilities and handling standards, as well as security. Essentially, these vaccines are quite valuable, and states and people involved in the ecosystem, such as airlines, airports, ground handlers, customs agencies, need to treat these vaccines as extremely valuable and let's say, handle them as per temperature-controlled guidelines and regulations. From an industry perspective, IATA has developed guidelines on the carriage, as well as the transport of vaccines. We've also worked with our partners, the airlines, the airports, and governments to create independent validation audits so that stations throughout Africa are able to manage the flow of vaccines irrespective of who the manufacturer is. But also what we've done is, I heard the importance of data. We've created an online repository of cargo and pharmaceutical information for the industry through a program known as OneSource, which lists by airport, by airline, ground handler, the capabilities for these stakeholders to manage the cold chain pharmaceutical products that are coming through, not only in the African continent, but in markets in the Middle East, as well as around the world, so that stakeholders, governments, have a much more informed decision-making ability based on the solution providers that are out there.
So the supply chain integrity, to a great extent would rely, I assume, on visibility and the data, storing and processing that you mentioned. Are those processes at a level that is sophisticated enough right across Africa for everybody to have faith in?
Well, I think from an industry perspective, again, you have major hubs such as Addis Ababa, Jomo Kenyatta, and Nairobi, as well as South Africa. And then in the Western Central West Africa region, they are fed largely by Europe, but also through the major hubs such as what Ethiopian Airlines and Kenya Airways is doing. But also, let's not forget that the vaccine distribution is part of a larger ecosystem. So it's very much possible that the likes of Emirates Airlines, Qatar Airways, and Etihad Airways, which is part of the HOPE consortium, will be transporting vaccines from these massive logistical hubs in the Middle East into the African continent, because they've got the frequency, they've got the dedicated cargo aircrafts, and they're able to connect those vaccines much more efficiently from all around the world into the African continent. So while we do have those major hubs on the African continent, many of the hubs around the world will be feeding into the continent as well.
Thank you for that. Minister Hanire, if I could go back to you. So Mr. Khalid there was speaking about the importance of supply chain integrity. That's also, of course, something that gives people confidence in quality of vaccines, and confidence in quality has a direct impact on their willingness to take them. I'm wondering, have you had problems with people who don't have sufficient confidence in vaccines in general, or vaccines with very complex supply chains, and there's concerns over risks to integrity of the supply chain, that's perhaps making some people somewhat reluctant to take the vaccine?
Well, everywhere in the world you have vaccine hesitancy. Everywhere you have people who do not want to be vaccinated, people who resist any kind of attempt to vaccinate them. We had that some time ago against measles in the United States and some other countries. But here in Nigeria, you have people who also do not want to take a vaccine, who have said that they do not need a vaccine. They do not believe in that there is anything like COVID-19. But we do have enough people who want to have the vaccine. And we're lucky to have a good legacy from the polio immunization effort, the polio eradication initiative, which left us with a lot of equipment and infrastructure. We have state-of-the-art cold chain storages in major airports and in zonal storages, and also at the very small locations at the ward level, you have direct drive solar powered refrigerators which can take the temperature storage at the temperature at which you want your COVID, at least the AstraZeneca vaccines. So we have no problem with that. We have a lot of experience with moving vaccines around the place in routine immunization and very recently in a polio eradication effort. And if there is any hesitancy, it is not connected with the integrity of vaccines. The integrity is quite well maintained as far as our own operations here are concerned.
And Cabinet Secretary Kagwe, is that a similar situation in Kenya? Is there confidence in the integrity of the vaccine, the physical supply chain, as it were?
I think that the hesitancy on the vaccines has a lot to do with global stories about the efficacy and what is happening elsewhere. When, for instance, European countries stop the use of AstraZeneca, then you get that hesitancy and you get questions in people's minds. And when we also say that under normal circumstances, there would be hesitation anyway about vaccines everywhere on Earth. But when you talk about emergency use, because essentially what is happening is that we are in a clinical trial, almost a global clinical trial, because there is no telling what is going to be happening at the end of this year, and people are aware of that. And the resistance that you see, however, has nothing to do with the integrity of the vaccines as a result of the global chain. Because, for instance, in Kenya, the Gavi cold chain equipment optimization platform is what we have in use, and it's huge capacity. Again, because of the continuous immunization programs that we have. So that's not a real problem. The problem, or rather the challenge, would be where people are doubtful about the vaccines, and therefore the need for an intensive risk communication campaign to address that doubt.
So with a certain amount of hesitancy, as you have in every country around the world, with the supply challenges that we discussed at the start of the session, how long do you really are you optimistic that in Kenya and in Africa generally that this point of herd immunity, I think it's sort of 60-70% of population immunized to achieve that. Are you optimistic that's achievable within a reasonable time frame?
Well, two things about the herd immunity. The first one has to do with the natural herd immunity. It's only that we don't really understand it yet, but there is a natural building of herd immunity anyway, particularly within the African countries where the virus symptoms are fairly asymptomatic. And in fact, one of the questions that have arisen in discussions on this issue is to what extent is a person who has had the virus immune enough not to take the vaccine? And since there is no answer to that, everybody kind of takes the vaccine. But the question at hand is not really whether we can build herd immunity. We can build herd immunity if the vaccine is available. The issue then becomes that how long will it take to build that herd immunity? Will we build herd immunity as a result of vaccination, or are we building herd immunity as a result of people getting the virus anyway, being infected by the virus anyway? So these are technical questions that have got to be answered. But if we are talking about the purely building herd immunity on the basis of vaccinating 70% of the population, then this is likely to take a little bit of time. When you look at the promises that are there even today, and I go back to what my brother from Nigeria mentioned, as well as Mr. Orina, by now, some 40 million doses are supposed to have been distributed from the AstraZeneca, from the COVAX facility. So far, only about 12 million, as far as yesterday's reports are. It's about 12 million that has been distributed. Now, when you think about 12 million, and you take the time, and if you ask today, it's not a question of money. It's a question of supply capabilities. So when you look ahead, and today, if you walked into the market today and you said, I want to buy some 5 million doses, either on the COVAX facility, the AU facility, or any other one, you would be hard put to know of a supplier who can get those doses in the next 3 weeks. Mm-hmm. So, for instance, we think that the Johnson & Johnson production lines might be very, very useful for Africa. But even then, you're talking about potential production starting sometime in June. Now, that takes you towards December and to the next year, and so on and so forth. So I think that this immunity, the herd immunity on the basis of the supply, on the basis of vaccinating people, is a challenge.
So we just have a couple of minutes left, and thank you very much for that, Cabinet Secretary. But perhaps I could go round to everybody very quickly and get their view on the issue that, which seems quite apparent to me from this discussion, that the biggest concern is the external supply of vaccines. Is that something that everyone would agree with? Perhaps I could start with yourself, Mr. Hadley.
Yes. Sorry.
Yes, I would agree with that. I think listening to what everybody says, it's not only in Africa though, but as particularly in Africa, is the supply of these vaccines. Everybody would like it as quickly as possible because we'd like to vaccinate our populations as quickly as possible. So I concur with that.
Mr. Orina?
Yeah, but I think I would like to add one more point to say that, of course, COVID-19 comes on top of other challenges that exist for populations. And I think it's important to underline that the continuation of vaccinations, routine immunizations is as important. It's also important for us to continue to think about other challenges that populations continue to face in terms of what the impact has been on livelihoods. And then therefore, because as we have been working with populations across the continent, many people clearly are raising issues in terms of needing other health needs and other livelihoods challenges, and therefore it's important for that also to be borne into account, so that there is support for populations to continue to improve their health needs. The last point I want to make really is more an appeal to government to continue to include those populations that are vulnerable, and especially those countries that have large concentrations of IDPs, refugees, and migrants within the continent, to continue to pay particular attention to that, knowing the vulnerability of these categories of population.
Indeed. Mr. Khalid, do you have some final words before we wrap up the session?
Sure, no, absolutely. Having a vaccine is only the beginning. We need to get it to the far most remote places, not only in Africa, but around the world. But also governments need to work diligently to restore that capacity and connectivity, and also support the aviation industry towards restoring that connectivity, which has eroded over the last year.
Thank you very much. And Mr. Ehaniri, the final words from yourself?
Well, yes, that we fully support equitable access to the vaccine and the distribution mechanism. needs to be
and permanent representative to the African Union. Union.
Even today, and it plans each and every in the whole country, and they
companies such as yours had to adapt their approaches to keep supply chains moving then?
And thank you, Laura, first of all, for having me in such a distinguished panel here. Yeah, of course, it goes without saying that none of us was prepared for a pandemic like this. And that has thrown us into the middle of a crisis. And for example, airline capacity had gone overnight as passenger flights stopped operating and many airports were totally disconnected from the rest of the world. Shipping lines were not able to call certain ports due to COVID restrictions. Borders were closed for cross-border trucking, and the list goes on. The pandemic has pushed supply chain to a whole new limit and challenged all models that are in place for prompt, safe, and sustainable distribution. Apart from painful public health implications, COVID-19 has actually crippled the economy with the lockdowns around the world. Speaking of healthcare logistics, the challenges were many, including safety of our employees, particularly the frontline workers, stock availability, cargo movement, and the capacity constraints, to name a few. Our organization has exhibited both resilience and adaptability. Our contingency response has primarily focused on teams' safety, and secondly, on ensuring uninterrupted supply chain to our customers. We have revalidated our service model to include a robust and a secure approach to storage and distribution, accommodating sometimes temporary space for stocking up, finding alternative freight options like running our own charters and full
0.35 billion population.
Thank you so much, Your Excellency, Dr. Vardhan. A very encouraging update there. Thank you so much. Madhav Kurup, the Regional CEO of the MESA region, the Hellman Worldwide Logistics. Thanks so much for being with us here today as well. Now, Asia, of course, encompasses a vast and diverse geographic range. So as a logistics company servicing the region over the past year, through border closures, lockdowns, and resource shortages resulting from the pandemic, what have been the most significant challenges, and how have logistics companies such as yours had to adapt their approaches to keep supply chains moving there?
Thank you, Laura, first of all, for having me in such a distinguished panel here. Yeah, of course, it goes without saying that none of us was prepared for a pandemic like this. And that has thrown us into the middle of a crisis. And for example, airline capacity had gone overnight as passenger flights stopped operating and many airports were totally disconnected from the rest of the world. Shipping lines were not able to call certain ports due to COVID restrictions. Borders were closed for cross-border trucking, and the list goes on. The pandemic has pushed supply chain to a whole new limit and challenged all models that are in place for prompt, safe, and sustainable distribution. Apart from painful public health implications, COVID-19 has actually crippled the economy with the lockdowns around the world. Speaking of healthcare logistics, the challenges are many, including safety of our employees, particularly the frontline workers, stock availability, cargo movement, and the capacity constraints.
Effort for a given country must be led question of days efficiently the Australian government has leverage with the resource of the Australian
contingency, but relying on our already tested and proven healthcare experience and adaptability. Our contingency response has primarily focused on teams as global logistics provider. We think we have a huge responsibility on our shoulders for maintaining storage condition and securing validated cold chain across different geographies. And our team has revisited our cold chain management policies processes through prepared route risk assessments, qualified approved transport providers, and looking at out-of-the-box packaging solutions and with a real-time smart visibility option. So it has pushed us into a completely an innovation mode, which is on our footing. Our strength has always been creative solutions and profound expertise in healthcare logistics. For example, our real-time temperature monitoring capabilities, our integrated the supply chain solutions, and Helmets control tower offering real-time intervention should any in-transit deviations occur. Route risk assessments receive any solution design. We look at high potential sensitive port pairs, perform assessments and lane qualifications performed. This is the basis of our risk management approach. That is so vital to the compliant execution in the healthcare supply chains. All solutions are available through our digital platforms. I hope I explained. Question?
Yeah, brilliant. Thank you so much, Madam. I've known you mentioned how challenging was this past year must have been, but of course that is Pfizer innovation as well, doesn't it, as you mentioned. Dr. Pascal Reham, co-founder of the Group Medical Director of International SOS. Now, of course, International SOS has extensive experience working in challenging environments and locations. So how can your experience be applied in the current situation with regards to the provision health services and specifically vaccine distribution, particularly to locations with access, infrastructure or funding challenges.
Good afternoon, and first I would like to thank you for organizing such a summit, which I think is very important, and for inviting me to share international SOS experience. First thing, at international SOS, we strongly believe that the vaccination effort for a given country must be led by the local authority. However, the government resources in many countries are already stressed and challenged by the burden of COVID-19. And the government still need to address all other health issues. Therefore, what we recommend, and we have been able to work together with government in many countries, is a public-private partnership operating within the national guideline. We think that the private sector should be engaged to complement and relieve government effort. I will just give you two examples which are happening at the moment, right at the moment. Since few weeks, the Republic of Papua New Guinea is facing a sudden, very sudden outbreak of COVID-19. The Australian government has offered some support which has been accepted by the PNG government. And one of the priorities decided between the two governments is the emergency vaccination of the health worker of Papua New Guinea. To deliver this quickly, it has been done. It's being done in a question of days. Efficiently, the Australian government has leveraged with the resource of the Australian private sector including companies like ourselves, which are already operating in Papua New Guinea. And therefore, in a real very short time, we have been able to start vaccination in PNG. Another example public-private partnership, which is also happening at the moment. It's in Indonesia. I was there last week. The government of Indonesia months ago has made some agreement, especially there are stock of Sinopharm vaccine available in the country, a new vaccine coming at the moment. The government of Indonesia has authorized some companies operating in very remote locations to access those stock of vaccine directly, as long as the vaccination will be provided free of charge to their employees, the family of their employee, and in some area, the local population living nearby the mine, the work site. Several international clients have engaged with this program. So at the moment, on behalf of our clients, we have designed a program to deliver and administer the vaccine to those populations using our established world-side health infrastructure and leveraging our existing community outreach program. The International Health team, which were on site already, have been supplemented by other staff. They have been trained in a very short time to follow the international guidelines and have been certified by the local health authority. As I just mentioned, our supply chain team have identified what we call the weak links in our supply chain due to the specific requirements of those vaccines. And we have reinforced them. In leveraging those existing human and supply chain resources, the mining company got the vaccine to their employee and family living in very remote location in a very timely and cost-efficient manner. And at the same time, it did not use public resources which are able to be focused on other areas.
Dr. Pascal Ray, co-founder and group medical director. International SOS. Thank you so much. Great update there. Thank you. Well, as we've heard throughout the two-day summit, of course, we're experiencing pretty much the biggest global logistics challenge in history. The Director General of the WHO yesterday spoke about, of course, the importance of coordinating a global response. So, Your Excellency, Dr. Harsh Vardhan, how do you see global powers coming together then to operate and supply vaccines worldwide within the current situation?
I think your initiative of Pope Consortium, I think it's a welcome initiative, and it certainly is going to help shape the future policies in a much better way as far as the coordination for vaccines, equitable distribution for the whole world is concerned. I think it requires a lot of awareness to be raised at all levels and discussions and debates because the World Health Organization is already trying hard. It started working long back on ensuring that there is a common platform to in fact help in research, help in vaccine development, help in validation, and then of course to ensure that all vaccine manufacturing countries of the whole world, they are on the same page, they are on the same platform, and then everyone is committed for equitable distribution of vaccines to every part of the world, to every country. For all related, whether it was testing, tracking, surveillance,
Brilliant.
because of science and technology. Those people above 60 and those with morbidities who were like the 80% of the people who in fact lost their life during COVID were those in these age groups. So people all have to be prioritized. And then for a huge country like this to have created and ensured that there is a perfect cold chain mechanism, although we have a huge, robust universal immunization program, whereby we vaccinate millions of children every day for 12, at least a dozen vaccines through the government of India. So all the gradation of these facilities and then calculating and then creating 50,000 centers all over the country, and then it was like training almost 7 lakh workers who are involved in the vaccination of COVID. So building up this capacity, creating task force at multiple levels, at the national level, at the state level, at the district level, and even at the block level. Also, people, and then to ensure that using the digital mode and creating the COVID platform, we can deliver everything in a seamless manner, and that we can right now ensure. And then, of course, there was this moral responsibility of striking a balance, but what we do for our own countrymen and what we do for the rest of the world. So, under the leadership of our Prime Minister, this challenge also we could overcome, and we have struck a good quality balance between the needs of the world and the needs of Indians, and by prioritizing people in India, we have already, as I said earlier in the program, that we have already supplied vaccine almost 64 million doses to 84 countries of the whole world. So these were some of the challenges, but with a leadership of a dynamic leader like Prime Minister Narendra Modi, we could overcome all these challenges. And now, on one hand, we have successfully handled COVID with some of the best recovery rate in the whole world and the lowest fatality rate of 1.34%, and also in a seamless manner trying to deliver vaccine to the people of India, everyone above 45 years of age. He can register himself through a platform, go to the nearest private or a government hospital. At a government hospital, he gets vaccine free of cost, and then even if he walks into a center, and the number of such centers in the whole country is almost 50,000. So you can well imagine that in a vast country like India, there were challenges at every level, but we tried to handle each and everything most meticulously, most scientifically, took the help of professionals, took the help of the scientific community, and as much as we call the year 2020 a year of COVID, we also call it in India a year of science, because I have seen the scientific accomplishments of the people in India. They have done us so proud. So we strongly believe that if we try to involve the whole society, try to involve the whole government, and try to create a people's movement, that is what we try to create in India for fighting COVID also, and now for vaccine also. We are trying to create a Jan Andolan. Now with vaccines, the issues that cropped up earlier in the early stages of the vaccine delivery mechanism were about vaccine hesitancy and all those misinformation campaigns on the social media platforms, about which you see we had to encounter vaccine hesitancy, vaccine eagerness issues, etc., etc. But with good quality systems in place and diagnosing each and every issue very, very meticulously and finding solutions and actually providing treatment for those issues, we could ultimately overcome all these challenges. And we have in fact converted all these challenges and adversities into opportunities in India, and that's why we have been able to actually handle the whole issue quite successfully, we believe, till now, on both the fronts, handling COVID and also giving vaccination to our people to protect them for the future.
It really is crucial, to learn from each other, especially at this time at the moment. So thank you so much for your update on that. Madhav Kurup, tell us more about how partnerships like the HOPE Consortium are effective in helping to support supply chain efficiencies and optimization of the global distribution of COVID vaccines. And what role does the UAE play as a hub for vaccine distribution across Asia?
Yes, if we had to applaud the leading position of United Arab Emirates and the consortium have played in fighting this pandemic. The vision has been domestic and also international. The consortium has really set a structure and drew an efficient path for management and distribution of vaccine. As we heard yesterday from the panels, from the chairman of the Department of Health and also from the Abu Dhabi Port, so the vision is really to have Abu Dhabi as a license hub. And what is worth acknowledging is that this is not just a seizing ambitious opportunity, but most importantly, it is by a large collaborative humanitarian approach from UAE, attempting to support the neighboring countries. The consortium is playing an imperative role in managing complex logistics around vaccine distribution, ensuring safety and integrity of vaccine with a plan of around 18 billion doses of distribution in 2021 for different countries in need. Partnering with governments and NGOs and private sector, consortium has successfully pulled their all stakeholders around the table and focused all efforts on combating COVID-19 rather than wasting time on competition and individual approach. I think you also asked the question on what is the UAE's role in this vaccine distribution. And managing a pharmaceutical cold chain hub, as I already mentioned, is not a new thing for UAE. It is actually a very well-oiled machinery. And it is easy to plug into this from a supply chain point of view, very, very easily. UAE's vision and leadership position, in addition to the advantage of geographic location, the country plays an equally critical role in rendering UAE as a hub for vaccine distribution. The UAE's commitment to alleviate this pandemic is translated in efforts made to upgrade the supply chain infrastructure in terms of airports, seaports, and most importantly, the seamless documentation processes to transit Dubai. UAE is a well-oiled machinery, as already stated. The capacity that UAE offers in terms of the airlines, a lifting capacity from the vaccine-producing countries like India is substantial. The airline capacity out of India primarily driven by the UAE air carriers for the rest of the world. And also the potential to move some of these products via sea in 2 or 3 days, around 3 or 4 days from India to Dubai by sea, and then again taking the massive capacity available in Dubai to the rest of the world is an immense importance to the whole vaccine distribution process. So I see UAE as have a major role to play in when the real distribution of vaccines start flowing all around the world, from the pharmacy of the world, as I say, in India now. So it's going to be UAE can play a substantial role.
Dr. Pascal, so how exactly are countries investing in capacity building to best support vaccination program rollouts? And are there any regions in particular that are of a main concern as well?
Well, I think as it's a little bit too early, we say, to make some definitive statement. I think it comes to an issue of having the fund, having the means to do something, and therefore the countries which are very much underfunded in public health today are the ones who are not doing very well with this crisis. I don't think. But what is encouraging is there are a few things that we have been able to witness. First, and thanks to the, I would say, digital technology, what we are seeing is that the information, education, communication, which has been used quite efficiently to promote during the past month the social distanciation, usage of masks, and all of this, the same resources are now being used to explain the promotion of and promote the vaccination and to dispel a lot of fake news. I was in Jakarta last week, and I'm impressed on how the message is getting through the population. I'm not sure it is the same in the country, but at least in the large cities, the education and the message is getting through, and you see the attitude of the population really affected by those messages. And I saw in another panel there was a lot of question about how the population accept the vaccination. I can tell you what I've seen in Indonesia and in other countries in Southeast Asia, is that the vaccination, if people can get vaccinated, they get vaccinated. Okay. What we are seeing also, which is encouraging in some countries, is that the public health infrastructures, which have been left under-resourced for so many years, some funds are now redirected to them. So we are seeing some money getting back to the public health infrastructure, which may not have been the priority for the previous year. In the private sector, and we are witnessing this with some of our international SOS clients, the corporation have increased the money that they are spending to support the health of their employees. And this money is being used very quickly, those additional funds are being used very quickly to reinforce resources which were already involved in some program, but thanks to this additional fund, we are able to create education about COVID and push the vaccination as well as other programs. But rather, if I may come back to what Mr. Kirk was mentioning, I would say it's great to inject money, it's great to inject new resources, but there is a fundamental point that we need to be very cautious about, is to avoid wasting the dose, wasting the vaccine which are available. And so I will go back to the supply chain and having the proper process, this process needs to be supported by technology. So we need to have consistency in the information, consistency in proper data reporting. For every location, we need to assess the storage capability as well as the daily vaccination capabilities. This information needs to be made available to the central warehouse to make sure that one location is not overloaded with shipment. We have seen locations receiving shipment and the shipment were just wasted. So the last point, which has already been mentioned, we should not forget the importance of the training of the health professional, and rather than throwing health professionals, just like train the one who are available, already on the ground, to make sure that they know how to use what will be sent to them.
Thank you, Dr. Pascal. Your Excellency, Dr. Harsh. Vardhan, back to you. And I'd actually like to get back to this inspired initiative, the HOPE Consortium, which of course is founded to provide supply chain solutions to support the safe and efficient distribution of COVID vaccines. Do you feel that public-private alliances like this are timely in light of the global need to roll out vaccines to global markets?
Sorry, I couldn't follow your question properly. I think you probably asked me about the alliances that are taking place right now around this vaccine distribution. Is that the question?
Exactly. Private alliances, yes.
Yes, you see, this is something which is a most welcome step, and I would like to congratulate the Hope Consortium, because this is exactly what is the need of the hour, and this is what organizations like yours are trying to actually contribute to the whole world. The World Health Organization does things at a bigger level, the higher plane, but ultimately the spirit of that alliance or working together, it has to be implemented at multiple levels, and multiple agencies, multiple stakeholders, multiple organizations, and multiple countries, and people with organizations with vision, the leaders, thought leaders, everybody has to come together and everybody has to contribute, and a synergy of the highest level has to develop in this whole world, where if we have to really fight COVID. And I strongly feel that COVID has taught many lessons to this whole world, and we have learned to come out of the silos. We have learned to fight together, and when we are fighting together, we have been able to counter COVID in a much better fashion as compared to if we were not doing it together. So I think this is a welcome move, and this should inspire many others in the whole world, all those organizations and other consortiums who may not be right now focused on this particular aspect. They should all, for this crisis moment, focus on this aspect and contribute in some way or the other to ensure that there is a strengthening of relationships, there is a strengthening of strategy, there is a strengthening of joint strategy, there is a strengthening of movement around this fight against COVID, which should be aided and supported by everyone. So this COVID has brought forth for us all these alliances, and we are in the right direction. Now it is a question of ensuring that the spirit of the alliance is most honestly honored, respected, and implemented by each one of us all over the globe.
Thank you, Your Excellency. Now, sadly, we are running out of time, so I'd like to turn over to Madhav Kurab as we close the session. Please tell us your final sort of thoughts and the key messages you'd like our audience to go away with from our discussion.
Yeah, I know we are out of time, but I just quickly want to compliment Dr. Harshvardhan because I think the efforts the government and the leadership in India have taken is example for the world, because when the whole COVID started, everybody was worried about what would happen in India, and how the government, the leadership, and the whole citizens of the country have come together to counter this is incredibly a great achievement, and I hope it will continue to be that way. The key challenges for the vaccine distribution, as I mentioned, is cost, capacity, and compliance. So in a highly diverse world with complex regulatory processes and infrastructure challenges and expertise challenges, it is highly critical that any organization which has the knowledge and ability to integrate end-to-end solutions with the full visibility will help vaccine producers to ensure product integrity until it reaches the patient. So it requires alliances, partnerships, and the engagement of governments, NGOs, the private sector, and the experts to resolve gaps and hindrances of the movement of vaccines and clearance and documentation processes that should not be a bottleneck. So this all this put together, we can solve the threat of this pandemic and hopefully get back to normal life pretty soon.
Thank you, Madam Kurab. Dr. Pascal, your final thoughts and key messages for our audience, please.
So, sorry to repeat myself, and to repeat the other panelists that mentioned, I think the key issue for the Asian country is to get the vaccine, to get the dose. So every effort and all those group effort, COVAX, orders are absolutely essential to make sure that the country can get their fair share of the vaccine. What we are seeing as a responsibility of the private sector, where we cannot do a lot in getting the vaccine, where we can really help in making sure that when the vaccine are there, the vaccine are not wasted, and the vaccine are getting to the people who need them in the most efficient way. We have seen also that the new technology, digital, can help considerably in training, improving processes, and we need to absolutely digitalize all those supply chain, all those information, all the data reporting, again, to make sure that we are making the best usage of the vaccine which will be made available to each and every country.
Thank you, Dr. Pascal. Your Excellency, Dr. Vardhan, I'd like you to close our session, if you may, with the key messages that you'd like our audience to go away with from our discussion today.
My very small message would be, you see, when we were fighting COVID last year and when there was no sight of the vaccine on the scene, I used to tell my own fellow countrymen that don't bother so much and be desperate about the real vaccine. You already have a very potent social vaccine in COVID appropriate behavior. This mask is the most potent vaccine, the social distancing is the most potent social vaccine, and then of course hygiene around your hands, sanitizing your hands, etc. So the COVID appropriate behavior was the most potent social vaccine, which is equally powerfully important even now. And now when the vaccines have come on the scene, they are being delivered to the people. The message for the whole world is that let us develop a Jan Andolan, people's movement around these vaccines, where we should all pledge to ensure that there is equitable distribution of vaccines and we are able to provide vaccines ultimately to people all across the globe. And also not forget, under any circumstances, COVID appropriate behavior, which continues to be the most potent tool to fight COVID at the moment. So that is, I think, the message that I would like to give in brief as a closing remark for this discussion.
Thank you so much, Your Excellency, gentlemen. As mentioned, public-private partnerships, reinforcing existing infrastructure, careful analysis, as you mentioned, and identifying weak spots are just some of the vital components mentioned in our discussion today. As we depend on each other for prosperity and as we build on an inclusive recovery going forward. Ladies and gentlemen, that brings us up to date with vaccine production and distribution across Asia. A very detailed and impactful discussion there from our panelists, who really have given us some truly unique insights. An update in our last and final panel of the day and of the entire summit. It really has been so interesting to hear from you all and what needs to be done. We do have to leave it there, sadly, but thank you ever so much once again for being with us here today and for sharing your thoughts and advice set with you with us. Thank you so much.
Thank you.
कर लो कोड कर दो
Distinguished delegates, excellencies, very good morning, afternoon, evening. It's my pleasure to welcome you to today's mission briefing, member state briefing. Without further ado, I would like to hand the floor to Dr. Tedros for his opening remarks. DG, the floor is yours.
Thank you, Tim. Honorable Ministers, Excellencies, dear colleagues and friends, good morning, good afternoon and good evening. At the World Health Assembly last year, Member States requested that I, as Director General, carry out a vital and specific task. In Resolution 73.1, you asked me, I quote, to work closely with the World Organization for Animal Health and the Food and Agriculture Organization of the United Nations and countries as part of the One Health approach to identify the zoonotic source of the virus and the route of introduction to the human population, including the possible role of intermediate hosts, including through efforts such as scientific and collaborative field missions, which will enable targeted interventions and the research agenda to reduce the risk of similar events occurring, end of quote. As you know, an international scientific and collaborative field mission traveled to China in January of this year and worked with scientists there for 4 weeks. The team has now completed its initial studies, and the report was made available to both the WHO Secretariat and member states over the weekend. The team of scientists came from around the world: Australia, China, Denmark, Germany, Japan, Kenya, Netherlands, Qatar, the Russian Federation, the United Kingdom, the United States of America, and Vietnam. I offer my gratitude to this group of experts from all over the world who worked tirelessly on this report under intense pressure. And I would like to thank them for their dedication and commitment. Now, I would like to invite the colleagues of the international team, Dr. Peter Benenbarek and Professor Liang Wanian, to present their key findings. Dr. Benenbarek and Professor Liang, thank you so much once again for your collaboration and hard work. You have the floor. Peter.
Thank you, DG, and welcome to this Member State briefing session. Could we have the slides, please? We have prepared a very short presentation to help you digest the report. And after the presentation, my colleagues, Professor Liang Wanyang, will also make a few remarks from his side. So on next slide, please. On these slides, we have tried to summarize the very large amount of activities that were conducted as part of the work into better understanding the origin of the virus. As you may remember from the July mission agreed terms of reference, we had agreed that the core of the work should focus on several areas. One of them would be to look at a series of epidemiological studies into the early cases detected in and around Wuhan, trying to understand and find new earlier cases. For that, we looked into a very large amount of data made available by our Chinese colleagues, either as raw data or in digested forms or as results of their own studies, a series of retrospective studies looking at data from surveillance systems. We also looked at the identified cases in Wuhan in the December 19 period. We also looked, of course, at the market, the Wuhan market, who was the place from where the first cases were detected in December 19, try to get better understanding of the role of this market in the event, and also looking at a series of studies done on animals in and outside China, try to get a better understanding of the potential role of animals in this event. And of course, we also look at the molecular epidemiology side of this event, looking at all the genetic sequences being identified and collected in that period and trying to link all that information together in a meaningful way. Next slide, please. So here are some examples of the type of data we looked at from the epidemiological side. On the left side, you have results from looking at surveillance system data on fever cases, on ILI, RE, and also unspecified pneumonia cases. So these are surveillance systems that pick up cases from different health centers throughout the province. And out of more than 70,000 of these individual reports coming from 233 health facilities, close to 100 cases were deemed to be more interesting to look at, but at the end were all seronegative for SARS-CoV-2 when their samples were retested this year. There was also on the right side, you can say, a lot of work done on understanding the confirmed cases that we have for the first part of this event, for the December 2019. And as you can see from that slide, we have now 174 cases confirmed for that period, and showing that throughout December the number of cases were rising, both among cases having a link to the market, and of course more and more as we move throughout December, And moving into January, more and more cases appearing outside with no link to the market and appearing outside of the market. Next slide, please. We also look at excess mortality data, meaning the number of deaths recorded. And on the left side, you can see that going all the way. Each square is a picture of Wuhan, the city of Wuhan, with different districts, and going all the way back to the summer of 2019 by week. And you can see that towards the bottom, when we start coming to December, we start seeing excess mortality in Wuhan, starting around the district around the market, and then moving throughout January and February throughout the city. On the right side, you also see clearly the indication that Wuhan was where we saw the uprising in mortality cases in early January, compatible with the fact that the disease was already spreading early January and late December in Wuhan, while at the bottom the same numbers from Hubei province of Wuhan were coming a little bit later in January, showing that, or giving again a good indication that the event started in Wuhan and then spread to other parts of the province later on. Next slide, please. As I said, we also look at the market, the Wuhan market. Here are pictures from now in January, where the market has been closed for a year. Next slide, please. It's a huge market, more than 1,500 stalls, vendors. As you can see, these are four pictures of the same market, with each square one of the vendors, and showing which vendors were selling what type of products, both aquatic product, meat and wild.